Welcome to everyone this afternoon. I'm Paula Fujiwara. I'm the Scientific Director of the International Union Against Tuberculosis and Lung Disease, which we refer to as the Union. And I want to welcome all of you to the official opening press conference, and a special welcome to a group of TB survivors who are sitting in the room also, people from South Africa, India, the Philippines, Indonesia, Cambodia, Tajikistan, so you can really see how tuberculosis is a global issue. Now, the Union is, of course, the custodian and host of the 49th Union Conference on Lung Health, taking place this week here in The Hague. And we are all delighted, really delighted, that the event is already making waves on global media websites, and I cannot stress how important it is that we maintain the momentum around tuberculosis in this post-United Nations high-level meeting environment. So let me say two things to set the scene today. I was in New York at the high-level meeting last month, and the political declaration signed by world leaders has made it very clear that what we've been championing for years to end the TB epidemic, we need better diagnostics, better drugs, more of those drugs in regimens, and an effective vaccine. So we were delighted to see that the inaugural TB Science event yesterday and today was a sellout. Our co-chair described it as historic, I believe. And I think it indicates that there's a thirst out there for discussion and evaluation of the evolving basic science, which is really going to be the basis of these new tools. Secondly, and very significantly, the HLM also brought to the fore the issue of tuberculosis as a human rights issue. And we were delighted here to be able to talk to the issue of childhood TB, which the Union has been championing this past year and also going forward. So on that note, let's begin. First, a bit of housekeeping. This press conference is being live streamed on the conference website, and an archived recording will be available on the conference Facebook page later. So those of you who are watching online, a big welcome to you. We'll be hearing brief remarks from all of our speakers here, then I will open it up for questions. And once the press conference is ended, you can approach a number of these speakers for a one-on-one interview. Our first speaker needs no introduction. José Luis Castro, to my left, is the Executive Director of the Union, and he will reflect briefly on the UNHLM, which I've just mentioned, and what it means for us this week here in The Hague and going forward. So, José, please go ahead.
Thank you, Paula, and good afternoon, everybody. Welcome to the 49th Union World Conference on Lung Health. The theme of this year's conference is Declaring Our Rights, Social and Political Solutions. Mobilizing society and political leaders against TB is just as important as having doctors and nurses that deliver the vaccines and the medicines. Just a few weeks ago, as Paula mentioned, world leaders gathered at the United Nations General Assembly for the high-level meeting on tuberculosis. This was the first time in history that the United Nations convened heads of state and governments to focus on ending TB. The UN General Assembly then approved the first UN political declaration on the fight against TB. This declaration was historic for TB because through that declaration, heads of states and government from virtually every country in the world pledged to reach specific, measurable milestones towards ending TB between now and the year 2023. This includes commitments to provide preventive therapy to 30 million people who have been exposed to TB, including 4 million children. To treat 40 million people for active TB, including 3.5 million children. To invest 13 billion annually in TB care and services. To invest 2 billion annually in research and development. And they pledged to put human rights as the guiding framework for the response to TB. People with TB have the right to access treatment and care. These rights cannot just exist on paper or a declaration that is written on. As the world's oldest tuberculosis organization, we are calling on presidents and prime ministers to keep their promises. Our only hope of ending TB will come with the new financing. With the tools that we have now, we are fighting this deadly epidemic with one hand behind our backs. And we need a vaccine, we need a new treatment regime, and we need new diagnostics. World leaders just made a historic pledge. They have not yet come forward to say how they will pay for it. So we must see that the new funding is on the table to accomplish all these pledges. Thank you.
Thank you, Jose. Our next speaker is Kitty van Weezenbeek, who's the Executive Director of the KNCV Tuberculosis Foundation and who is our local host for this conference. And she will briefly talk about the role that both KNCV and the Netherlands have played both domestically and internationally in fighting tuberculosis, and indeed continues to play today. Thank you.
Thank you, Paula. A warm welcome on behalf of KNCV Tuberculosis Foundation. This is the third time that KNCV is a co-host, a local host of the Union Conference. The first time being in 1932. And then Queen Emma opened that conference, and because her sister, Sophie, died of TB. TB is everywhere. We are very happy to say that Princess Margriet of the Netherlands is now our patroness. She opened the centennial dinner yesterday and will open the conference tonight. We were established as the umbrella organization of civil society organization. Every single city had its TB association, caring for patients when there were no drugs, no cure. So we exist for 115 years. We should celebrate, but we shouldn't. In fact, I'm probably the only executive director that would like to close the doors of her organization, because it's a shame, it's unacceptable that still 1.6 million people annually die of a curable disease, and among them almost 250, a quarter of a million children. This is why we have dealt with TB in the Netherlands. We have a lot of experience and expertise to sell in the world. And already from the 70s, we have been working all over the world. We have now 500 employees working in many countries in Africa, in Eastern Europe, in Asia. And we are proud to do that work. We always work hand in hand with the government. But it's exactly like José said. We need new tools. And it's remarkable that the deadliest infectious disease of the world is getting just a fraction of the R&D money that is being given to other diseases. Of course, we are not saying that other diseases should get less money. On the contrary. But we should be recognized that if we want to deal with this epidemic, we have to invest. AMR, antimicrobial resistance, is a major problem, and too many people are dying. So what are we doing? Introducing new drugs, new regimens, but tools alone will not do the job. And this is why we had this HLM. We need political commitment, we need the human resources, and we need civil society engagement to end this epidemic. Tomorrow we will announce what we think is a breakthrough in the diagnosis of children, and I encourage you to come to the press conference at 12:30. Thank you, welcome, enjoy The Hague, and let's have a great conference. Thank you.
Thank you, Kitty. Our next speaker is Paul Jensen, who's the Policy and Strategy Director at the Union. He's been a driving force behind the Union's work on childhood TB, and we'll speak briefly about that work and where we're headed. Paul.
Thanks, Paula. I've started working on TB policy about 15 years ago, and I can tell you that throughout most of the years I've been working on TB, children just have not really registered on the global health agenda, the global child survival agenda, the global TB agenda. You just see an absence, a void of where the attention on children who have TB should be, or who have been exposed to TB. About 10% of all TB is in children. 1 million children under age 15 every year become sick with TB. About 250,000 die. 90% of those children who die from TB, no one diagnosed them, no one treated them. It's not like all the children in the world who have TB are living on some undiscovered island in the middle of the ocean somewhere. In most cases, we know where they are or where to find them. They're showing up sick to health facilities and they're not being properly diagnosed or diagnosed in a timely manner, and I think you'll hear more about that. Those stories are captured in this book. Or they're already living in the same home as adults with TB, including adults who have already been diagnosed with the disease. And it just takes a health worker to assess the family situation in those cases, see if there are children in the home who have been exposed, and reach them with appropriate services. There's no excuse for missing these kids. We're not talking about an act of God that suddenly sweeps 1 million children off the face of the earth unexpected. There's no mystery here. This is a silent slaughter. We know children are dying. We know how to find them. We know how to screen them. We know how to treat them. Every 4 years, 1 million children are still dying from this disease. How do you rationalize that? We're here in The Hague, a center of justice, so I'll mention that we released a report earlier this year where we mapped out all of the international treaties, international agreements, legal agreements that say that countries are legally bound to fulfill children's rights to health. And where countries are not doing that, we encourage them in that report to look at what legal avenues they have to compel treatment for children with TB, who the law says have that right to treatment. The theme of this conference is political and social solutions, so we are working really closely with the Global TB Caucus, a network of parliamentarians to drive attention to child TB. In August, we went to Uganda to look at solutions, an approach that the union implements there called Detect Child TB. It's really successful. And we just went to communities. We met with families affected by TB. We met with nurses, with health workers to see how they're doing it. And it's totally feasible to reach these children. There's a science to reaching kids with TB, but it's not rocket science. And the parliamentarians who were there, they come from similar communities. They know the issues, and they came back and they said, we need a 3-year work plan. So tomorrow we're meeting with the caucus. UNICEF will be there. Elizabeth Glazer, Pediatric AIDS Foundation will be there, other partners, and we're going to sit around the table and we're going to hammer this out. What do the next 3 years of political solutions look like in countries where children are heavily impacted by TB? As Paula and Jose said, we just saw commitments made at the highest political level. The most powerful people in the world came together with really, really good negotiators. They haggled over every single word of the political declaration for months, and they produced it with a lot of fanfare. And there are commitments to children in there that are specific, they're measurable, they're time-bound, and the clock is ticking, and their credibility is now on the line. But in order to reach these targets and reach these children, we really need a groundswell of support. And so what this conference is designed to do is to create a moment where we start to see a change in the status quo when it comes to children with TB.
Thank you, Paul. So our next speaker is Blessi Kumar, and she is the CEO of the Global Coalition of TB Activists. And the coalition today is launching its new book, Childhood TB and Stigma, Conversations of Resilience in the War Against Tuberculosis. And she will briefly describe the work behind the book. So Blessi, please go ahead.
Thank you very much, Paula. And thank you all for being here. And we've heard a lot about numbers. As a mother, it really is mind-boggling. I can't get around the fact that 700 children die of TB every day, most of them before they reach their 5th birthday. And I think in 2018, this is something that I find extremely difficult to understand when we have the drugs, when we know where they are, what is stopping us. And yes, there has been a lot of progress. There has been a lot of commitment, high-level political commitment. But what is it at the ground level? How is it at the ground level? How does that commitment get unpackaged at the ground level is a big question that we ask ourselves. Now, these are the numbers of the disease burden. But what cannot be seen is the human suffering, the struggle, the pain, the death, the loneliness, the stigma, and the world just passing the children by and leaving them behind. Now, this is what we, as the Global Coalition of TB Activists, have tried to bring to the world. We are a very small group of people, of TB survivors, who are committed to give a face to TB, to ensure that people affected by TB actually lead the response, that they are engaged with meaningfully in everything that concerns with TB. And that's where our efforts have been. And this is what we've tried to highlight in our book. Each story is a story of battle to get a diagnosis, to get the correct treatment and support, and a story of struggle to keep the little ones alive. Story after story, as we interviewed, edited, and printed, we did it with tears. Because mostly parents, mostly mothers, really fought hard, gave everything they had to keep their children alive. Some were more fortunate, some were in a much more difficult situation. Children separated from them for a year till they recovered from drug-resistant TB. Those are stories which will really wrench your heart. For every success story, albeit being an uphill battle, there are thousands who didn't make it. And it is for them that we need to talk about TB in children. It is for their sake that we owe it to every life that was lost, that could have been saved, that we need to ensure that children do not get TB. It can be prevented. We need to make sure that they live their lives to their fullest without being stigmatized, without being discriminated. And we need to make sure that the world realizes and understands and supports people who are living with TB, struggling for survival. Each of these stories in the book are of the brave parents, mostly mothers, as I said, who fought and won that battle. These are stories of resilience. Things are not easy when you get affected with TB. And as a TB survivor, and as many of my colleagues who are in this room today, we know, irrespective of where you are from, whether you live in an urban slum or you're a professional working in a hospital or you're a CEO, the struggles are similar. You still lose that human face when you walk into a hospital. You become a number. And that needs to change, and that can only happen if we can join hands. So GCTA today is very proud to launch this book on childhood TB and stigma, which is a compilation of conversations that we've had with these brave warriors. And I'm absolutely delighted that we have with us our very, very important guest, Angie, here with us, who's a brave TB survivor herself, who's come all the way from South Africa to launch this book for us. Thank you, Angie.
Thank you so much, Blessi. Very, very, very moving as usual. And so our final speaker is Janet Grab. I'd like to say a big thank you to you, Janet, and also your adorable daughter, Angelina, for coming all the way from South Africa to be with us today. So Angelina contracted tuberculosis when she was only 2 years old, and she's now 9 years old, big 9 years old. And Janet would like to describe what that experience was like for her and Angie. So Janet, please go ahead.
Thank you very much, and thank you to everyone for the opportunity to be here today. Yes, as Blessi said, Angelina was just 2 years old when she was diagnosed with TB. She had been sick for some time before that, and we already knew that Angelina was battling with a primary immune deficiency. She has a condition called common variable immune deficiency, which affects both her B and T cells in her immune system. And she had about 3 bouts of pneumonia during that year, and she just really wasn't doing very well. Then she started to experience fevers, unexplained. We couldn't find any source of infection. Then she was not gaining weight. She was not playful. She was attending a play group, but the teacher would say she would sit all day and not do much. She didn't want to play with other children. And she just really didn't look well. So we kept on going back to the pediatrician. We are fortunate to have medical aid, which is health insurance in South Africa. And so we kept on looking for answers. We were sent to cardiologist to see if there was a problem with her heart, but that came back clear. And then eventually her pediatrician sent us for a chest x-ray and some blood work. And it was then that we discovered that she actually had TB. So when we got the diagnosis, it was both a relief as well as a somewhat daunting prospect, because although it was a relief that we knew what was wrong with her, but it was quite daunting to think of 6 months of treatment ahead of us. And so we began the journey of treatment, which was, as I say, it was difficult to give her treatment every day. Especially in the beginning, she really struggled to take the medication, and I'm sure most people who have children know how difficult it is to give medicine to a 2-year-old. So one that doesn't taste very good doesn't help. But she was very brave, and she got through the treatment, and we finished our 6 months, and she has been clear of TB since then. So we're very grateful that we could access the treatment, and we are definitely one of the lucky ones who managed to get a diagnosis and treatment in time to prevent further damage or spread of the infection. So thank you.
Well, thank you very much, Janet, and thank you, Angelina, for going through that process so you can be with us today so healthy. Now we'd be very happy to take your questions. We have roving microphones, which our volunteers will pass to you should you want to ask a question. And when I call on you, please state your name and your media outlet. Keep the questions brief and indicate to whom you are asking the question. So it is now open. I've said this before, I know that journalists are not shy. So anyone who has a question, please go forward. I can see someone there. Amy.
Hi, it's Amy from Health E-News from South Africa. Thank you so much for coming, Janet. I just wanted to ask, I've heard that it's very difficult to be treated in the private sector for TB in South Africa. The private sector is completely unaware of TB and don't look for it. And that actually it's one of the only things where you get better treatment in the public sector. Was that your experience? And do you think it was because you were in the private sector that maybe it was harder to get the diagnosis in the first place, or is that not really the case?
Thank you. Yes, I do think so. I do think that it's not on the private sector's radar as much. We had a very good pediatrician, and he he did the diagnostic workup, but then the treatment for the TB we had to access through the public sector. So as soon as we had a diagnosis, we then had to go to a public sector clinic, our local clinic, and we had to go monthly there and sit with all the other patients on the day, waiting for their treatment, and there was no way to access the treatment at all through the private sector. We were told you can't buy the medication through the private sector at all. It's only available at public sector clinics. Yeah.
Yeah, hi, I'm Nadine from CNS News.
Yeah, my name is Nadine from CNS News, and it's lovely to see you here, Angelina. You make this very bright, this day in this press conference. I just wanted to ask Blessi if you could say something about stigma. We often talk about stigma as if it's just one thing, and I know from your experience, and I'm imagining in the book that there's levels of stigma. It's social stigma, it's self-stigma, shame, all of those things. Could you say a little bit about what you found? Thanks.
Sure, Nadine, thank you for that great question. So people think that there's no stigma associated with TB. And the series on stigma actually came up, in an effort to understand TB stigma better. So our first book was on women and stigma, which was released at the UN High-Level Civil Society hearing in June. And stories from that and from our childhood TB series helped us understand that wherever you are, like I said before, there is stigma associated with TB. It doesn't matter whether you're rich or poor, whether you live in a city or in a slum, whether you're a daily wage worker or a professional. Stigma actually is there with every one of them. And one is fear because there isn't enough information available. I'm really sorry to say that many physicians even today do not know that TB should be your first suspicion if a person comes to you coughing for 2 weeks. But TB is like, right down the list, which is why diagnosis takes so long. People don't talk about TB so much. It's not our dinner conversation, is it? We don't talk about it at home. So when there is no information, there is fear. And fear really reinforces the stigma. And when you don't know much about it, you kind of move away. I mean, I know there wasn't much stigma but Janet did say that when she took Angie back to school, it was very difficult for the headmistress to understand what she had gone through. And she was suggesting that maybe we don't talk about it. Maybe we just, keep quiet. And many doctors have said this too, people who've diagnosed with TB and said, maybe don't talk about it. Every story in the book, they said, we hid it from our relatives. So we need to really break this chain of stigma, and that can only happen if we make it dinner conversation. If we are not embarrassed to talk about TB, if we are not embarrassed to say, I survived TB, that's how the stigma is going to break. Because when there is stigma from our environment, we start stigmatizing ourselves. There were many women in our Women and Stigma book who said that they became so recluse because they started blaming themselves and they lost their confidence. They couldn't be who they were before they were affected by TB. So stigma is a huge issue. And I know KNCV has done some tremendous work on trying to understand stigma, measure the stigma. And Nadine, you yourself have sort of led this in trying to understand and see how we can address stigma? What are some of the strategies we can use to bring that stigma down? But I think simple thing all of us can do and encourage others to do is to talk about TB, to talk about how it's spread, to talk about how we can prevent ourselves. It's very simple. It's not rocket science. The more we talk, the more the fear will be elevated, and that will lead to less of a stigma.
Thank you, Blessi. Any other questions? Yes.
Hi, this is Tina. I'm from India, Hindustan Times and Mint. Blessi, this is for you. I want to know that India is the highest burden country. Where do we stand when it comes to like children and TB in India, about the medication, and where do we stand?
Very interesting question. Thank you. So, as you rightly said, India has the highest burden in the world. And children are left behind generally in India and like in most other developing countries. There hasn't been enough of attention of bringing childhood TB high on the agenda. We are just about getting our politicians to talk about TB on the whole, despite the fact that we have the highest burden. We have 1,400 people dying of TB every day in India. And like I have said to our politicians over and over again, it's like 3 jumbo jets crashing every day in India. And would our response be the same? Would we be sitting back? Would we not be really doing something to address that? So TB itself is only now coming up high on the agenda. But childhood TB very specially needs a lot more attention. And not just from the community, it needs everyone to be talking about it. The researchers, the developers, the civil society, the NGOs, the TB program managers, everyone needs to push it so that this gets the attention. The parliamentarians need to be talking about it, need to be raising questions in the parliament about why we haven't done much. India is a country that has developed so many new tools. Why aren't we developing the new child-friendly drugs, the diagnostics that are so much needed? I think this is a question I'd like you to actually pose to the people back in India. Why aren't we leading that fight against childhood TB in India?
I think there's a question from Rita. Rita?
Oh yeah, sorry. My name is Rita from Indonesia. I would like to, would you mind, Janet, if I ask Angelina about her experience when she's went through all the medication and how does it feel now? So would it be okay with you, Janet? Thank you. Angelina?
So I don't remember much. But I do remember the medication. It wasn't that nice. There was this tablet, but you had to dissolve it in water. It was red. It was very grainy, and it was very, very bitter. It's not very nice. So afterwards, I always used to blind my mom for a sweet so I could get that taste out my throat. But I'm glad to know that I survived it, that I could be here today talking about it.
Any other question? I think that Paul on our panel has a question.
I don't have a question. I just had to add a little bit to what Blessi was saying, to the question that you asked. And I think it's worth raising the international policy guidelines for preventive therapy in children. So the current guidelines are that if you are age of 5 years old and below, and you live in a household where an adult has been diagnosed with TB, and the child is not sick, the recommendation, it's a strong recommendation that they receive preventive therapy. Or if you're in a household in a more economically developed country that has low burden of TB, it doesn't really matter what age you are. It's a strong recommendation you receive preventive therapy. But if you're a child, say if you're 6 years old and you're living in India and your father or your mother is diagnosed with TB, you've been exposed, the recommendation is not to give you preventive therapy. So that's the current guideline. I think it's fair to say it's a very conservative guideline, and I'll leave it at that.
And Kitty would like to say something.
This was indeed the case, and it was inequity. It was inequity. You do your child 6 years, 8 years old in the Netherlands, you would give preventive therapy, but not in Africa. We have been fighting for that. It has changed. Recently, WHO changed the guideline, but now it comes to implementation. And this is why we still need technical agencies like the Union, like KNCV, to assist countries, work hand in hand with countries to do that. Because there's no preventive therapy, really, even the children under 5 years. So there's a lot to do. We should realize 1/3 of the, 1/4 of the world population is infected with TB. Fortunately, only 5 to 10% get sick, but we don't know who's getting sick. This is the situation. And some of these people, in fact, more and more are infected with drug-resistant bacilli. We are not there. I wanted to come back to stigma. Stigma has been there for ages. My mother had TB as a child. My father had TB in the 60s, had his lung taken out. Everybody thinks that I'm in TB, and I'm going to say that in the opening. Everybody thinks that I'm in TB already since 81 because my parents had TB. I didn't even know. They only told me after I joined TB because of the stigma. This was the case in the Netherlands, and I have had a discussion with 12 MDR-TB patients in Jakarta, where we work. All of them lost their husband, lost their work, lost their way of living. It's incredible. It's setting specific, so we have to be careful not to have one dogmatic approach how to reduce stigma, but it needs to be addressed, because women who are afraid to lose their husband or men who are afraid to lose their work will not seek diagnosis, will not seek treatment. So ending TB, part of that is really looking at social issues, and that's why the theme of this conference is so important. Thank you.
Any other questions? Because I'm going to do something. Oh, yes.
Hi, Janet. Thank you for sharing your story with us. I'd just like to know a little bit more about your experience of stigma in school, like what Blessi was saying. If you could please elaborate on that. Thank you.
Sure, yes. So when Angelina was attending a creche at the time she was diagnosed, and so I immediately went to the principal to inform her about that. Angelina, she actually didn't cough at all. She wasn't coughing. And the pediatrician assured us that she was actually not infectious, and she was not, she didn't pose any risk to the other children. And we had that in writing from her doctors. But still, when I went to the principal, she actually begged me to not tell any of the other parents about the diagnosis, because she was scared that they would all take their children out of the school. So I said to her, well, I am going to tell them, and I'm very happy for them to call me and for me to explain to them exactly what the situation is, and we can give the doctor's letter to all of them, and they're welcome to also contact the doctor if they would like that. So it did turn out well in the end, and I had some questions from other parents. Obviously, I think fear is a big issue. Obviously, it's natural. As a parent, I understood that maybe if it was my child who was being exposed, that I would also have questions. So I didn't mind that, but I think that everybody learned a lot through our experience. And we tried to tell as many people as possible to try and dispel the stigma as well. Yeah.
I want to do something. Look, Dr. Rosa Herrera. Hello. I'm going to call on her. She doesn't know. She didn't know I was going to do this, but she's actually in this book, and she's a person. She's a doctor who's actually on the border of with the United States. And she's actually taking care of the children with tuberculosis. So just to give, like, what do you think the key issues are for children as you were taking care of them?
Well, I would like to mention also that I'm a TB survivor, and that's one of the main reasons I work with TB. Well, I think that it's really important to take place and put them as a priority in the priority list. We always talk about the groups, the risk groups, and we sometimes mention children. It's not always there. We always mention HIV, drug users, but we don't always mention children, and it is important to put focus on that. We have been, as said in the book, neglected this group of age for decades. And now trying to put focus on that. Obviously, we have been we need to actualize everything about the movement on tuberculosis. Even when a new drug develops, when a new diagnosis develops, it doesn't count on children on their clinical trials. They're outside. We need to focus on them at the very same time as the science develops, so the children can be there too. On the field, or one of the main problems is that science develops kind of slow. Just these few past years have been faster, but the other issues when develops the guideline, and then comes the good one when we have to put it on the field. That takes a lot of times. That could take 5 to 10 years to actually be put it on the field because of resources, because of the local guidelines. And I think that the priority is a key for achieving